Hi, I'm Mesha Rebstock, and I'm a professional counselor with Lady at the Sea Clinic in La Rose. I've been doing this since about 2012, and I see a wide range of patients. Parents and guardians, I'm talking to you guys. We've all seen the post on Facebook or have heard it in conversation. The person without kids yet who says, I would never, or my child will never. And all you can do is chuckle internally because they truly have no idea. As a parent, as well as a clinician, I can truly say I thought I'd have everything under control. I thought I'd stick to my rules and never give in. Well, joke's on all of us. Raising kids is hard. It's a constant state of picking your battles and learning as you go. Parenting is learning how to reinforce good behaviors, curb bad habits, and shape good judgment. And in the battle to raise them to be good humans, we face a lot of mistakes on the kids' part, but also on ours. But what happens when your child's behavior is truly escalating, beyond the typical struggles of parenting, perhaps out of your child's control? We could be looking at clinical disturbances, ADHD, impulse control issues, oppositional defiance disorder, or more. Attention deficit hyperactivity disorder, or ADHD, may include inattentive symptoms, hyperactive symptoms, and/or impulsive symptoms. Some people only have one cluster of symptoms, where others can have all three. Though most signs surface in childhood, ADHD does persist into adulthood. Oppositional defiant disorder, or ODD, is a behavior-oriented diagnosis characterized by defiant, negative, irritable, uncooperative, and deliberate behavior that defies authority figures. Individuals with ODD may argue or talk back excessively, refuse to comply with requests, intentionally upset others, blame others for mistakes, and can have an overall angry or irritable mood. These two conditions can exist separately or can occur together. Both ADHD and ODD are going to surpass average misbehavior or inattention. All kids are going to show some version of misbehavior out of human error. ADHD or ODD, however, will affect functioning, learning ability, and/or connection to others. Living with ADHD and/or ODD can be frustrating. Raising children with ADHD and/or ODD can be trying, but here are some tips to help. To start, stick to a schedule. If expectations are consistent, it's easier to form patterns. Try establishing set times or days for certain tasks to be completed. It also helps to have some visual reminders, whether that be a sign, a planner, a calendar, or sticky notes. It also helps to break big tasks into smaller steps. For example, telling a child with ADHD to clean their room might be too big of a task for them to narrow down. Instead, try make your bed, then pick up your toys, and so on. Staying calm is also very important. Yelling at someone who is already off task and/or angry is not going to help. Step away if you feel yourself escalating. For little kids, I use a skill called the brain check, which looks like this: brain check. Those two simple words and silly gesture are usually enough of a reminder to get back on focus, and no yelling is necessary. Remember to be generous with praise. We want to make sure to reinforce good behaviors and draw attention to those. Kids with ADHD often fall into negative thinking patterns that they are less smart or less capable than their peers. And this is absolutely not true. It's important to remind them of this. I often tell kids their brains are just capable of thinking more things at one time than mine is. It's basically a superpower. And lastly, pick your battles. Prioritize what is most important. People with ADHD or ODD should focus specifically on the most important things they need to get done. Sometimes we need to disregard the little things and focus on the bigger picture. As always, if you feel you or your child is escalating and need help, seek some support. Medication, counseling, parent training, and behavior modification are all ways to help cope with ADHD or ODD.